Hello, everyone. I'm an occupational therapy assistant student at the State College of Florida, and my name is Brianna. And today we will be talking about a spinal cord injury at level L3. So, the L3 dermatome in this area of the skin receives its sensation through the L3 spinal cord nerve, and it includes the front portion of the thigh and the inner part of the leg, kind of shown here in the picture. Um, all of the muscles within that region assist with knee extension and can run up into the lower hip. That helps kind of a little bit of bending at the hip and the external rotation at the hip. A spinal cord injury at this level may show some numbness or weakness of the thigh or inner part of the leg while moving the thigh or knee. A spinal cord injury at this level, they're never really identified as complete injuries because they have such a wide variety of mobility once the injury has happened. Um, However, some people with an injury at this level could have more hip and knee movement, but then lack the sensation to be able to move the ankle or anything within the lower leg region. Some of the major movements that are usually seen that are affected are knee extension and, like we said earlier, external rotation of the hip. Difficulties within one's home environment could look like reaching things on high shelves. Adaptive equipment would be needed for the person to be able to independently shower and use the bathroom. Balancing to get dressed would be difficult, so using a dressing technique and sitting down while getting dressed would be safer for the client. A lot of clients with an injury at this level also use knee, ankle, foot orthoses, and or they may have forearm crutches or a wheelchair to kind of navigate their environment. Energy conservation is a big thing that we can educate them on when standing for longer periods of time. Lowering shelves in their house might be another option that we could do to help them more be able to function independently. Reaching shelves in a grocery store would also be difficult because of lack of extension and then balance. And driving, they can drive independently, but they would need modifications within the vehicle to drive. So in the next two clips, I'm going to kind of be showing a pinprick test for pain sensation in the thigh area and the knee area, and a light touch test. So in this clip here, I am doing the sharp dull test, and what that's going to do is test for pain or any kind of sensation in the upper thigh and knee region. And generally, what happens is you will alternate between the sharp side of an object, such as a paper clip or safety pin, and the dull side, and have the client identify which one you are poking them with. And this would generally be done on the unaffected and affected leg with the eyes closed. And in this clip, this is going to be the light touch test, so similar to the sharp dull test, but instead of using cotton, you are going to poke around on the thigh or any part of the region that might have the sensitivity issues or deficits, and you will ask them whether or not they feel the touch with their eyes closed on the unaffected and affected leg.